So here's my poster. Gotta get. And I did mine as a plant. I'll kind of explain it as I go through why I did it that way. But we start down here at the roots, and the roots are his history. He has a history. Oh, I'll start with, sorry. The center of the flower, information about my patient. He is an 84-year-old male. He is a full code, and he was assessed on 3/10 of 2020. His history is he has diabetes. He has a suprapubic catheter. He has a history of dementia and acid reflux, hypertension. He's living in a nursing home, and he's a widower, and he has no known allergies. So he came in on the 8th, 3/8 of 2020, for encephalopathy related to a UTI. That was his admitting diagnosis, was encephalopathy. His vital signs on the 9th, I kind of color-coded. Anything orange is the 9th, anything yellow is the 10th. So his vital signs for the 9th are his temperature was 98.9, which is a slight temperature for him. His heart rate was 70, respirations 18. His O2 sats were 94% at room air. His blood pressure was 158/69. And then by the 10th, his temperature had gone down to 96.8. His heart rate was at 69, respirations 16, blood pressure 137/69, and his O2 sats were 94% at room air still. I put my nursing diagnoses on the leaves of the plant, and my outcomes in the petals, and then the raindrops, which are going to feed the plant and make everything happen and be healthy, are the interventions, which I color-coded with dots to match the colors of the diagnoses in the leaves. And I've got my signs and symptoms of his encephalopathy related to UTI. So we have altered mental status, dysuria, polyuria, temperature of 98.9, loss of appetite, and nausea and vomiting. So the first nursing diagnosis that I have is nausea related to illness, as evidenced by verbal reports of nausea and vomiting 3 times the previous evening. So he obviously was losing fluids and electrolytes, and he wasn't eating well because of the nausea. He hadn't eaten since the night before. I tried to get him to eat breakfast. He said he wanted breakfast, and when I called to order breakfast, he got nauseous again and asked me to cancel his order. So our outcomes for nausea is that patient will verbalize feelings of nausea when they occur. He didn't talk a lot, and didn't communicate needs very well. At one point, he was leaning forward and had a grimace on his face, and I asked him if he was feeling nauseous, and he just kind of nodded his head and reached for the emesis basin, so I gave it to him. But for him to be able to verbalize, I'm feeling nauseous, would be helpful. Both for knowing when he needs medication and for being able to help him when he's feeling nauseous. Second is patient will be free of nausea for 4 hours before discharge. That was their goal for him. Patient will be free of complications of nausea and vomiting before discharge. As I mentioned before, his potassium levels were out of whack, his chloride levels were out of whack. And so they were working on getting those back into balance. Giving him potassium and chloride. His potassium level was almost normal when I left. So they were counting that as a win. But the interventions, and patient will be free of episodes of emesis for 8 hours before discharge. So they didn't want him to be vomiting for 8 hours by the time they released him. So my interventions for those are assess pain level often, administer potassium as ordered, watch for signs and symptoms of nausea and ask patient about it. My hope would be that in catching those signs and symptoms and then asking him, he'll be able to recognize, oh yeah, that's what that is, and maybe be able to verbalize it himself in the future. Administer lactated ringers as ordered and encourage fluid intake. Monitor electrolyte levels. Monitor intake and output. Administer ondansetron as needed, as ordered. And encourage food intake. He was taking a lot of medications and no food, and so I'm pretty sure that contributed to his nausea. The second nursing diagnosis is activity intolerance related to immobility, as evidenced by bed rest. So because of all this stuff that was going on with the nausea and with the electrolyte imbalance, he was weak. More so than normal. Normally they have him up on assist, but he was on bed rest at this point to help keep him safe and let him regain his strength. Administer potassium as ordered. Did I say that? Encourage fluid intake. Adjust positions as needed. Because he is on bed rest, don't want to have skin breakdown or get bed sores, and that'll also help keep him from being in joint pain. Encourage food intake to help him get his strength back, and monitor I's and O's just to make sure that his body is still functioning properly while he's on bed rest and inactive. And I forgot to read my outcomes. Patient will remain free of skin breakdown and bed sores while in the hospital, and patient will remain free of falls while in the hospital. And educating him, another intervention is educating him on the reason for changing positions and how to do so, and also how to do the control the bed position, because he kept forgetting how to use the bed controls, which would help him change his position. The last nursing diagnosis is acute pain related to biological injury agent, his infection, as evidenced by verbal reports of pain. My outcomes for that would be patient will be free of infection before discharge. Patient will maintain a pain level of 0 to 3 on a 0 to 10 scale for the duration of the hospital stay. And my interventions for that are administer pain meds as ordered, administer anti-infectives as ordered because the pain is caused by the infection. So if we get rid of the infection, then that pain goes away. Assess pain often so we know when to give him his medication. Educate patient on proper catheter care. Just to help prevent future UTIs. And adjust positions as needed to help with pain. this is take 3. And I can't remember if I went over his presenting signs and symptoms. So if I did, I'm sorry, but I'm going to do it again. So the clouds are his presenting signs and symptoms. We have altered mental status, dysuria, polyuria, his temperature of 98.9, loss of appetite, and nausea and vomiting. And then I've got my, where is it? There we go. I've got my key down here. Also current illness risk factors were diabetes, suprapubic catheter, dementia, and being 84 years old. Okay. So, there you go.